that okay if we take video in here?
Sorry.
Is that okay if we take video in here?
Oh, yes.
Okay.
Yeah, we already got the permission from the patient. Okay, I'll start. I've already applied IV sedation with propofol. She's sleeping. So I made a line from the lateral canthus to eyebrow. First, I make a 4-point on it. But I don't have to inject lidocaine because she's sedated. But for the presentation, I will. Actually, I inject a little bit amount of 포폴 8 더 주세요. 이만큼만 주면 되는 거 아니야? 여기다 놔줄까? 오케이. 자, 18번.
I have a question.
Yes.
When you mix sedation with local anesthesia, does it reduce the pain after the procedure?
Definitely. But it's just for presentation.
Okay. Okay.
Of course, it's very important to control the pain even after the operation, as you mentioned.
But is it too different if you don't do it and the patient is under sedation?
Yes. In this time, I applied the infiltrated the tumor center solution, but I usually inject the lidocaine directly. Well, I will insert 2 threads this way. Do you remember?
Yeah.
2 more threads this way, and add 1 more again.
Yeah.
1 dual leader thread this way. 1 more. Anyway, I will explain one by one. First of all, I will infiltrate tumor center solution along the pathway of the thread. It can reduce the pain and even bleeding. 니들 한번 더 줘볼래? 좋다. 안 줘도 되겠다.
Are you doing the numbing superficial?
Sorry?
The numbing is being superficial? The numbing?
The anesthesia.
The anesthesia, you're placing it
Oh, yes.
superficial.
Superficially, yes.
But you're opening the space that you mentioned in the class, right? So that's what you're doing, opening a little bit of the space for you to go in with the threads.
Could you speak slowly? 사람이 조금 숨 쉬게.
You want to speak slower?
Excuse me for a moment. Excuse me.
Yes, it's okay.
She's coughing.
What's cooler in the coffee shop?
다음에 뭐 하면 되나? I will answer the question after completing the infiltration. 니들 한번 다시 줘볼래? 너무 많이 주면 안 되겠다. 살짝 깨워서 숨 한번 쉬게 하고 다시 재울게. 자, 또 주세요.
At what plane are you going to be working today?
A subcutaneous layer. Usually subcutaneous. But once you accumulate a lot of experience and you can deal with a lot of complications, you can approach under the smooth layer. As I mentioned, there's a lot of important structures.
Yes. Are you going to do anything under the smash today?
Actually, I try to stay on the subcutaneous layer, above the smooth.
Okay.
Yes, but I cannot control it. Sometimes it goes deeper, sometimes it goes slightly upper, so we cannot control it completely. Anyway, yes.
Just try to keep
Above.
Okay. As a not beginner, intermediate position for safety, for this safety. 됐어. 이제 그냥 가보자. 다 넣었나? 다 넣도록 그때 해야지. 다음 팀 올 때 해야지. 자, 적어주세요. 넘버 3, WA PDO로 주세요. 넘버 3 PDO인데 WA 캐놀라로 되어 있을 거야. Could you make a pathway for her? 뭐냐, 코그마스터 기어 1, 2, 3, 4, 5, 6. 오케이. First of all, I make the hole wider with forceps. What's this? WA cannula. And what's this? The negative cork.
It's Master 6.
Yes.
Cork
Cork
master.
master gear 6. Great. Thank you. I can insert the thread. So when you feel the resistance, do not advance it. Just go back and try it again. Softly. Insert the thread softly. Before removing with this thread, negative cork, the Coggmaster Gear 3/6, you should push the thread a little bit more when you start to remove the cannula.
Okay.
After remove the cannula, you pull the thread a little bit more to fix the cork on tissue. Also the same. Remove this, pushing the thread again. But for this two thread, I insert the thread upward. When you miss some, 뽀폴 6 주세요. Massive bleeding. Don't be upset. Don't be panic. Just press that area for a moment. Air stopped easily. Also the same. Simple. Pressing the skin with the scissors, but be careful not to cut the skin. Yes, sometimes we can make mistakes. We should restore the dimpling. Simple. Okay, but not enough. PLACL 1 for better fixation, for better. 코그마스터 기어 4번인데 okay. I think it's not enough, so I'll insert PLACL as well. Okay, it's white. What's this?
Coggmaster.
PLACL. But the model name is the same. It's a skirted cog. Can you watch out this?
Master.
Coggmaster 4.
Coggmaster 4, right? The WA cannula, Coggmaster Gear 4, PLACL. It goes for about almost 20 months. 20 months. 이거 좀 끼워 넣어주고 세워주세요. 커피를 마셔서 손이 벌벌 떨린다. 자, also the same. I can insert these two threads oblique laterally. When I'm at the resistant, go back and try again. Okay. Okay.
You always use the same ratio from PDO from the other ones?
No,
Depends on each patient.
definitely. 주세요. 하단. 자, 다음에 넘버 3 PDO로 만들어진 거 4개 나오세요. 2개만 쓰고 2개는 다음 쪽으로 넘어갈게요. 저거 하나 줘봐. 우리 아까 로컬. I forgot to inject this point. 다음에 니들 주고 infiltration 하나 주세요.
Todos estamos pegados como metros. Me dio mucho calor.
요거 주거냐? 튜머 센터.
Y esta no la están usando. Thank you.
Okay. 자, the same. What's this? What? PDO.
Master Cog.
Master go here.
Gear. WA 6 코스트 마켓 6. 이거 마스터 게 6. 딴 거 주세요. 이거 넣어주고. I can insert the thread from the hairline to the jowl directly to correct jowl. One more thread from the anterior point of the tragus. Not too deep, not too superficial. Actually, it's enough, but I will add more for the presentation. 듀얼 저걸로 패러시엘로 나와봐.
If this were
2개 나오세요.
Sorry, if this were not a presentation, you would stop here.
Sorry.
If this were not a presentation, you would stop
Yes, for her it's enough.
here. Okay.
But to satisfy my patient more, yes, I usually add. Yes, because they expect a lot
They
of
want
things.
more.
Yes.
For example,
Oh.
in a rate from 1 to 10, with the traits that you have already placed, which will be the improvement?
What was? What's the question?
Sorry,
In
sorry.
a scale, in a scale
Oh.
of 1 to 10,
Uh-huh.
being 10 the best,
Uh-huh.
he want to ask you.
For her, maybe
what
3
kind of
to 4.
improvement?
3 to 4.
3 to 4?
Yes, I apply a lot of thread for severe case.
Oh, okay.
Almost 50 to 10, 50 to 60 for one patient. 이거 뭔데? What's this?
Del-
Pure Peralacia.
PLA.
Peralacia. So please, you don't have to try dual. So once you should accumulate with the thick thread first. It's easier.
¿Cómo los haces?
I insert. 잠깐 이렇게 하는 게 맞냐? 이쪽이 아니지. 이쪽 맞구나. Okay. 1. Insert one more thread. 2. 다음에 가위. 놔둬볼까? 같이 깔까? 포폴 6 주세요. 좀 아파시겠다. 그래서 테이퍼 포인트 니더. Not sure. Sharp. 해주세요. Okay. So you should be very careful. You should prevent
Can I
the
see
hair.
the rest?
You know, the hair inserted into the skin cause infection. You should. Oh no, it's already contaminated, so you can put it there. Release. You can release the wrinkle. You should release the wrinkles. 오케이. 자, 다음에 그 저거 4개 나와라. 투어 PDO 4개 나오세요. I've completed the thread lifting on the lateral face. I will insert the thread from the jaw to medial canthus and lateral canthus to correct the medial face. What's this? Okay, I will show you. PDO.
Master cup, master
Mm.
here.
Oh, it's a Visu.
1, right? Because loaded on a L-type cannula, but it's a thinner. So 19 gauge. Previous one was 18 gauge. It's a 19 gauge. 끼워주고. For the medial face, we should choose thinner one. The layer on medial face is not clear. It's mixed. So you should be careful. When the cannula end reaches the targeted point, you should twist 1 or 2 rounds before removing the thread to fix the thread on that point. Pull the thread a little bit more. 멀티 있나? 거기 멀티 없으면 우리 멀티라도 꺼내. 쇼트로. 짧은 거 PDO로 꺼내주세요.
Ya iba bastante siglos, ¿no?
No, es que no nos entendió. Él dijo que con
How much is she going to improve?
How much she gonna?
Grade of improvement.
Grade of
From 1 to
improvement.
10. From her concern.
Wow. It's really difficult to answer. It depends on a lot of situation. So
Do you usually
I
recommend
expect
a
about
diet or something?
4, 5 maybe. So
In order to improve the results, do you recommend a diet or something for patients to do at home?
actually no. Please do not take NSAID or steroid medication because the collagen synthesis it requires inflammation. If you reduce the inflammation, the effect of thread will be decreased as well. 또 뭐냐 이거? What's this?
Visu.
Hmm?
Visu.
Visu? Multi-line. Yes. So there is a marine line here. To make it flat, I insert. Oh, it's not sufficient. Neither.
So the multi-line you inserted from upwards to downwards, right?
I'm sorry.
The multi-line you inserted from upwards to downwards then?
Yes,
Okay.
up to down. But it depends. I'd like to use this hole, which is created by the dual needle. So we should reduce the number of skin hole for the patient.
I have a question also.
Mhm.
If you want to improve the results and you want to combine it with any other technology like CO2 laser or radio
Definitely.
Yes, you can. It doesn't interfere with the results or with the threat.
Well, it depends. What kinds of device do you use?
CF laser,
Uh-huh.
radio fractional microneedling.
Definitely. Almost always.
Okay.
Almost.
At the same time.
Uh,
Can be done the same day.
It depends on the device. For me, I applied some lifting laser before the procedure, but it's less invasive. Nothing changed. But after that, I apply thread directly on that day. Uh-huh. But I can also inject filler. Uh-huh. I can also apply HIFU before the thread lifting on that day. Why not? Uh-huh.
Okay.
Uh-huh. Okay, this is the end of my presentation on the right part. Thank you. So let's compare. But the result is not so predominant. You know, the Korean has very thick skin, so it's very heavy. It's not so predominant. But 머리 좀 잡아볼까? Okay. Excuse me.
Que te manifiestes verbalmente.
오케이. 사진 카메라 저기 보셨어요? 네. 자, 오 많이 좋아졌네 진짜. 내가 봐도 좋아졌다. 오케이. 예, 레이 다운 어게. 쭉 내려줘요. 쭉 내리세요. 끝이지? Where is it? 이 사람 더 줘볼래? 여기 있다. 오케이. 자, 그 아까대로 실 준비해줘봐. 넘버 3부터. 보죠.
$3,000.
$3,000 que el gasto que hiciste
¿Ahorita?
Ajá.
또 줘봐.
¿Que por la cantidad de hilos que estoy dando?
Pero en México no.
No.
Que todos fueran de...
Calculé 18,000 pesos.
¿Qué? Como 18.
Como 18. Por eso le pregunto la pregunta. O sea, porque pues ya de esta una risa, pues sí, pues es una risa.
O sea, ¿cuánto
En
le
mi
vas a
pueblo anda
cobrar?
entre 25 y 30.
18 y 18, o sea, lo que vas a sacar son 36. Pero 36 si mejoras poquito, te van a mandar.
또 줘.
Por eso yo lo que veo es que los
Pero esos no los
los
tienen que
definido y luego CO2.
Porque no se venden, es lo que se decía, que como son 3 veces más caros,
Pues
los médicos no
pongo
quieren
hilos y
pagarlos.
le regalo el CO2.
De hecho, me causaron.
Sí, tienes que.
Sí, esos ya los tienen ya nada más que cuesta electricidad.
Claro. O sea,
Again, it's not needle. It's cannula.
Okay.
7 centimeters long. 23 gauge cannula. 23mm 맞지? 23 gauge cannula. It's very useful to infiltrate the tumescent solution.
alright.
자, 넘버 3 주세요. Again, what's this? Cog master gear. It's negative cog. Cog master gear. Cog master gear.
WA?
It's negative gear. Negative 6, right?
Okay,
WA
it's a
type
negative.
6. PDO.
Yes.
Okay. Medial. Oblique lateral. 자. 또. 또. lateral. vertically upward. 윤경이냐 유리냐 뒤에 유리구나.
So you never pull the thread.
To
Yeah.
fix to anchor the
Like
tissue
to anchor it, you don't pull it.
securely. Yes.
Okay.
To anchor the tissue securely. 또 주세요. What's this?
It's a PLA.
Sculpted cork. Sculpted cork. What's that then? PLACL. 코그마스터 기어.
Year 3.
4.
4.
4. 자. For the beginner, insert wrong nodes okay, but for better, it's,
Yes.
so this patient want the result to go further. That's why I insert PLACL additionally. When you PL. 자, 가해주세요. 다음에 넘버 3. PLACL, PDO, 코그마스터 기어 6, WA 캐뉼라, 네가티브 커그. Negative, not protruding, but negative cork.
Okay.
Positive cork, negative cork. 포폴 6 주세요. 오케이. 또 듀얼 리더 PLACL 듀얼 리더. You should insert 2 needle into one exactly the same skin hole. But it looks very simple to insert the needle, but it requires a lot of experience. Sorry, but don't be upset even though you are making some mistakes. Fortunately, the strap lifting never makes very serious side effects. Rarely, I mean. Please stop using mono thread. It's out of fashion. I've never used that kind of thin thread. 오케이, 주세요. You should release the dimpling with mild massage. 다 했나? 뭐 하면 돼? 오케이. 떨어지면 돼. 그냥 알아서 떨어질게. 알아서 줘. 저기 구멍 됐다. 한번 해볼게. 포폴.
여기요?
multi-line to make the stepping flat. To make the stepping flat. 오케이. 자, 우리 코깅 스크류 플러스 몇 개만 나와봐. 한 4개만 나와봐. 코깅 스크류 플러스 있습니까? 4개만 나와보세요. PLACL 비교야?
근데 사이즈가 약하네.
나 좀 보여줘. 나는 길이가 다르지 않아?
네.
136mm고 185mm. 136mm짜리 PDO로 PDO 그걸 줘보세요. 네. 그거 4개만 나와봐. I rarely use thin thread because I don't have to. So, but for presentation today I will use it.
Okay.
Thank you.
So you use 19 gauge and now you're changing to 18 or the other way?
Usually for lateral fixation, I want something strong. That's why I choose 18 gauge. But for medial, as I mentioned, I should choose thinner one.
Thinner one.
But actually, there is a 20 gauge. We also have 20 gauge. 뭐냐 이거는?
Estaba comiendo.
This is what's this?
It's a Cogging screw plus.
Cogging screw plus.
An 18 Cogging
Excuse
screw
me,
plus.
I'm old, so I cannot find out the tiny coke on the shaft of the thread. But yes, it has cutting coke on the
Yes.
surface. So our insert the thread how this way. Uh-huh. With thin thread, you should insert them very superficially for better result.
Okay.
두 개 주세요. I rarely use thin thread, but it's loaded on a needle. That's why it causes bleeding. Okay. When you remove this, oh sorry, 저거 좀 줘. 이거 좀 침 좀 묻었으니까. Okay. Sorry. 잠깐 일단 잘라내고 누릅시다. 가위 좀 줘보세요. The same. Pressing the brake. Can remove them. Don't forget to press that area.
Do you massage after or is that it?
Massage for what?
Downward.
To restore the dimpling. No. I do not apply massage.
Okay.
I just restore the dimpling. That's all. Don't apply massage. It will release the every anchoring. You cannot. You must not. Excuse me. 포폴을 조금 주세요.
Gonna be this
6 주세요. 나 네잘팁 오그멘테이션.
multi-line?
비주, right.
Voy a decir que estas son mis manos. Pero va a ser.
It's very painful. 꺼져 주시고. 오케이. 좋습니다. 비주 2부터 콜로멜라부터 주세요. 비주 2 콜로멜라. PLACL 비주 2. PLACL 2. Oh, it's very hard.
Can you go straight down to the nasal bone?
To ANS, anterior nasal
To
spine.
anterior nasal.
하나 더 주세요. 다음에 비주 2, 비주 1 for the nasal tooth elongation. For the beginner, do not insert too many bisu 2.
Okay.
It can make asymmetry. 2 is enough. Sometimes 1 is enough.
One of those.
비주 1 to elongate the nasal tooth. multi with the
Okay, so you're okay. Yeah. You're inserting a multi-line and then
multi-line.
Okay, got it. And,
To fill the supratip depression.
okay. And what about inserting a multi-line on the
Mhm.
nasal
Mhm.
tip? Do you recommend it for more volume or not?
Well, so
When they have like a subdivided
Uh-huh.
cartilage or so, do you recommend doing that to fill the
I don't think so. Okay, simple. That's all.
Okay.
Yeah. Super.
Thank
Yeah,
you.
thank you. Just ask it.
So the ones that you shouldn't be putting more than 1 or 2 is the Visu.
Two, 비수,
Visu.
비수 2? Sorry.
The thread, number of threads you shouldn't be putting more because the risk of asymmetry is Visu 1 over the dorsal.
No, 비수 2 for the
okay.
columella.
Okay,
Yes.
okay.
Uh-huh.
Doctor, have you ever experienced?
Thank you. Let's take a break and we will come back. Please keep your wears on. Please stay in my clinic. Don't go out. Please do not go out. Okay? Okay. See you in 10 minutes. Okay. Thank you.
Have you experienced any nerve lesions?
Yes, I have. But fortunately, it will recover spontaneously. Fortunately, because I usually use the cannula, not the shaft needle. Yes, that's why I think so.
How long does it take them to heal?
Several weeks.
6 weeks?
Several weeks. 3, 4. Actually, you do better to apply some steroid. Actually, we call it steroid pulse therapy.
Okay.
Uh-huh.
Do you recommend that?